It's Dr. Yum, and we're here with a very special Dr. Yum project partner, Michele Mansouri from Access Eye. And we're so excited to have you here, Michele, today. Thanks for being here.
Thank you for having me. I appreciate it.
So we appreciate you. This hour is really special because Access Eye is one of the Dr. Yum partner practices, and they actually have agreed to do a matching donation during this Power Hour. So they are matching donations up to $1,000 during this hour. So if you are thinking about giving to the Dr. Yum Project today, on the day of our Yumathon, this would be the time to do it because Michele is behind you with her team at Access Eye, and they are going to match your donations up to $1,000. So thank you for that, and thank you for being an awesome partner. Tell us about what your experience has been for these several months at Access Eye. I can't imagine how different things are for you guys.
I think that we're in the same boat that many people are that are in this profession. So at least, we don't feel alone. It's definitely been challenging. I think that there was a time earlier on, as you're aware, that we were required, or it was heavily suggested that we close to only emergent cases. So we were for quite some time only seeing patients that had a serious issue that needed to be addressed, which meant that all of those individuals that need things like an updated prescription for glasses or contacts, or really even a little bit more serious things like they needed to have their pressures checked for glaucoma patients.
Right.
It was something that we were sort of asked to just place pause on. So we did for a while, and things can't go on that way forever. So all of those patients that needed to be seen during that time frame that we were required to close are now being seen in addition to all of the other patients that are scheduled at this time as well. So we have been extremely busy. And because of social distancing and trying our hardest to keep everyone safe, our waiting room and our practice in general just looks really different.
Right.
We have to ask patients to wait in the car, and we have to ask patients to, only the patient to come into the office, wearing masks, of course. So yeah, it's been interesting.
It has. Well, we're so grateful that you figured out ways to safely see your patients again. I know, being in pediatrics, we have kids going back to school. They're doing learning now, maybe at home or hybrid, and they need to be able to see to learn.
Right.
And getting those yearly eye exams is so important, especially as kids are starting school again. So I'm really glad and grateful that you are back up and running and have figured out how to do this safely. It's just been, a challenging time, but it's, I think, caused a lot of us to kind of figure out how to do things in new ways. And maybe we've found some silver linings too. I don't know, have you found any silver linings to the pandemic? Maybe professionally or even personally?
Absolutely, in both regards. I think that it has forced us to make a move on some things that we were already considering. We already feel that we're pretty forward thinking. Most everything in our practice is done digitally, electronically. We try to stay away from paper, but we were sort of put in a position because of this to even eliminate some of the last few things that we had on paper. So now a lot of pre-appointment type information is done online. They get a text message, can easily get everything completed before they ever come to their visit. So that definitely has been helpful, and we've saved a lot of trees.
That's a bonus. I know, I think my patients too are appreciating some of the efficiency, and then being able to offer telemed visits and things that we've wanted to do, but this sort of forced our hand to come up with quickly ways to do things more safely. So yeah, I mean, of course, we wish we weren't in this situation, but we're at least finding some ways to get better at some of the things that we do. So, you know, we have appreciated your support all of these years. Dr. Mansouri and Michele Mansouri really were early on. You know, they saw our work and became partners very early in our story and have really stood by. And I just thought maybe I'd give you a chance to let us know why you've stood by us all these years and why have you been such a great supporter. We have just been so humbled by the support you've given us all these years.
Well, I think that there are a number of reasons why we believe in this project. First of all, I think the timing was right when we initially had that conversation. My husband and I both had recently started our own journey, taking our health far more seriously, our food intake, exercise, these sorts of things far more seriously, which probably sounds a little silly since we're in healthcare. I mean, obviously, you know, we're taught early on that what we consume has an effect on just about every part of our body, including our eyes. But I think that with growing our business at the time and just being extremely busy, we had opened 3 new locations within a very, very short period of time. So I think we just let our health take, it went to the back burner.
Sure.
So around the time that you and I were having that conversation, we had just taken our life back and we were just in that mindset. So I think for that reason, the timing was really good. I also think that, you know, you really keep us feeling so good about this project. I mean, I think that there are a lot of nonprofits, and as you know, I'm involved in several in the community.
Yes, you are.
But the Dr. Young project stands out because, you know, we know your passion, and we know that our ideals and intentions align. So it's really nice to be involved in something where you know that the organization is well led, and you know that the individual that started it all is still a part of it and driven, and well, we just love you.
Oh, well, we love you back. And we love that our partners really do use the resource and talk about the resource and have the materials in their waiting rooms. And that's really our intention of the partnership is you all see so many patients and you can spread the word about this mission. And, you know, this year has been really challenging for a lot of families. So we've tried as much as we can to help families now facing food insecurity, get into the food pantries and disseminate information about how families can be using these resources. So we love our community partners because of the way that they use their platforms to get our message out. So we're so grateful to you, Michele, and the whole team at Access Eye. And we're so excited that we have this time to do our Power Hour. And we hope that you will consider making a donation today so that the team at Access Eye can match that donation and we can continue our good work and really do that with our partners standing by our side. So thank you, Michele, for being one of those partners that's been standing by our side all these years. We love you. We love the team at Access Eye, and we wish you good luck as we hopefully emerge from this pandemic sometime. You know, we're all doing this together in our own corners, but collectively, I hope that we can come out stronger.
Absolutely. I think we will. I do. I really do.
Well, it was great spending the time with you, Michele. And thank you so much for all that you do for the Dr. Young Project and for the Fredericksburg community. You're a gem.
Thank you. It was great to talk to you.
Great
I'll see you
seeing
soon.
Talk soon.